Tell me about yourself.
Hello. Thank you for the opportunity to interview with you today. My name is Mihiraa, and I am a dedicated nurse with 5 years of experience in a fast-paced surgical ward. My career began with a strong foundation in patient assessment and care, and I have since cultivated a passion for ensuring patient safety and promoting a collaborative team environment. My professional journey has taught me the critical importance of a holistic approach to nursing. While my clinical skills, such as wound care, post-operative monitoring, and medication management, are a core part of my expertise, I pride myself on my ability to connect with patients and their families. I believe in active listening and clear communication to build trust and ensure patients feel heard and understood during what can be a very vulnerable time. This compassionate approach has been central to my practice and is something I'm very proud of. In my previous role, I became highly proficient in electronic health record systems and collaborated closely with doctors, physical therapists, and other nurses to develop and implement comprehensive care plans. I thrive in a team-oriented setting, and I'm always willing to lend a hand or share knowledge to help my colleagues. My drive for continuous learning is a key motivator. I'm always seeking opportunities to expand my knowledge and stay current with the latest evidence-based practices. I am confident that my blend of clinical skills, dedication to patient-centered care, and collaborative spirit would make me a valuable asset to your team.
How would your friends describe you?
My friends would describe me as a compassionate and reliable person. They would likely highlight my calm demeanor, especially in high-pressure situations, and my ability to listen without judgment. For instance, when a friend is facing a difficult personal or professional challenge, they often turn to me because they know I'll offer a thoughtful and supportive perspective. This is a quality that I believe translates directly into my nursing practice, where a patient's emotional well-being is as important as their physical health. They would also mention my strong sense of responsibility. If I commit to something, whether it's helping a friend move or organizing a group event, I follow through with meticulous care. This reliability is something they trust completely, and it's a core principle of how I approach my work. In nursing, this means being accountable for my actions, following protocols precisely, and always putting patient safety first. Finally, I think they would describe me as someone who is always eager to learn and improve. I'm naturally curious and enjoy tackling new challenges, whether it's learning a new skill or exploring a new topic. This enthusiasm for growth is what drives my commitment to continuous professional development, ensuring I stay current with the latest evidence-based practices. They see this drive in my personal life, and I believe it is a key reason I am a dedicated and effective nurse.
What are your strengths and your weaknesses?
My primary strengths lie in my clinical skills, my ability to work effectively in a team, and my compassionate nature. When it comes to clinical practice, I am highly proficient in patient assessment, medication administration, and emergency response protocols, ensuring that I can provide safe and efficient care. As a team member, I pride myself on my communication skills and my willingness to support my colleagues, which helps create a collaborative and positive work environment. My compassionate approach allows me to connect with patients on a human level, making them feel heard and cared for during what can be a very stressful time. My main weakness is that I sometimes struggle with delegating tasks. I have a tendency to want to do everything myself to ensure it's done to my exact standards, which can occasionally lead to me feeling overwhelmed. To address this, I've been actively working on trusting my colleagues' abilities and improving my delegation skills. I've started using clear, concise communication when delegating, and I've focused on giving constructive feedback to build confidence within my team. I'm now better at prioritizing my workload and recognizing when it's more efficient to entrust tasks to others, which ultimately benefits both my patients and my team.
Tell me about your current job/role.
In my current role as a nursing carer, my responsibilities are centered on providing comprehensive and compassionate care that addresses both the clinical and personal needs of the patients I serve. I work closely with a multidisciplinary team to ensure that each individual's care plan is followed meticulously and with the highest standard of quality. On the clinical side, I am responsible for a range of duties that ensure patient safety and well-being. This includes monitoring vital signs such as blood pressure and temperature to detect any changes in a patient's condition. I also assist with medication administration, ensuring that each dose is given accurately and on schedule. Additionally, I am trained in basic wound care and hygiene, which is crucial for preventing infections and promoting healing. Beyond the clinical tasks, a significant part of my role involves assisting patients with their daily living activities. This includes helping with personal hygiene, dressing, and mobility, always with a focus on preserving their dignity and promoting as much independence as possible. I provide support with meal preparation and eating, ensuring patients receive proper nutrition and hydration. A crucial aspect of my job is my role as a key communicator and a source of emotional support. I'm often the first to notice subtle changes in a patient's physical or emotional state. I meticulously document all observations and communicate any concerns to the senior nurses and doctors. I also provide companionship, actively listening to patients' concerns and offering a reassuring and empathetic presence. This holistic approach ensures that every patient feels supported, comfortable, and cared for.
Describe your working relationship with your colleagues.
I strive to build a working relationship with my colleagues that is built on mutual respect, open communication, and a shared commitment to our common goals. I believe that a positive and supportive team environment is essential for providing the best possible patient care. I am a strong believer in effective communication, and I make a conscious effort to listen actively to my colleagues' perspectives and share my own ideas clearly and respectfully. This helps to prevent misunderstandings and ensures that we are all on the same page. I also prioritize teamwork and collaboration, always being ready to assist a colleague in need or to ask for help when I need it myself. I understand that we all have different strengths and experiences, and by working together, we can leverage our collective knowledge to solve problems and improve outcomes. Ultimately, my goal is to be a reliable and supportive colleague whom my teammates can trust. I believe that a strong working relationship with my peers not only makes the workplace more enjoyable, but also directly contributes to a safer and more efficient healthcare environment for everyone.
When was the last time that you did not get along with another nurse?
It's inevitable in any professional setting to have disagreements, and in nursing, these often arise from different approaches to patient care. I can recall a time when a colleague and I had a difference of opinion regarding the management of a post-operative patient's pain. My colleague felt we should stick strictly to the prescribed PRN medication schedule, while I believed the patient's nonverbal cues indicated a need for a reassessment and a potential discussion with a doctor about an alternative pain management strategy. The situation was tense because we both had the patient's best interest at heart, but our clinical approaches were different. To resolve the conflict, I focused on a collaborative and patient-centered approach. Instead of arguing, I calmly explained my rationale, citing the patient's specific behaviors and my understanding of their pain scale. I suggested we both review the hospital's pain management protocol for this specific type of surgery and then present our findings to the charge nurse. By bringing in a third, objective party and relying on established protocols, we were able to quickly reach a consensus. The charge nurse agreed with my assessment that a reassessment was warranted, and we collectively adjusted the care plan. The experience was a valuable reminder that professional disagreements are not personal conflicts, but rather opportunities to learn from different perspectives and ensure the best possible outcome for our patients. We were both able to move past the disagreement with our professional respect for each other intact.
What do you like best about nursing?
What I love most about nursing is the unique combination of scientific knowledge and human connection. It's a profession that requires not only a deep understanding of anatomy, pharmacology, and clinical procedures, but also a profound sense of empathy and communication. The most rewarding part of my day is being able to provide comfort and care to a patient during their most vulnerable moments, whether it's by offering a kind word, patiently explaining a medical procedure, or simply holding their hand. That feeling of making a tangible, positive difference in someone's life is what drives me every day. I also truly appreciate the dynamic and ever-evolving nature of the field. Nursing is not a static profession. It demands continuous learning and adaptation. There is always new research to understand, new technologies to master, and new best practices to implement. This constant opportunity for growth and development keeps me engaged and passionate about my work. Finally, I value the strong sense of teamwork that is essential to nursing. Healthcare is a collaborative effort, and I have had the privilege of working alongside dedicated doctors, therapists, and fellow nurses who all share a common goal. The support and camaraderie within the team are what allow us to face challenges, celebrate successes, and provide the highest quality of care. This blend of compassion, intellectual curiosity, and teamwork is what makes nursing more than just a job. It's a calling.
What do you like least about your job as a nurse?
What I like least about nursing is the emotional and physical toll it can take, particularly when dealing with understaffing and high-stress environments. While I understand that these are often systemic issues, they can directly impact our ability to provide the level of care we know our patients deserve. The constant pressure to manage a heavy workload while maintaining a high standard of safety can be draining. Another aspect that can be challenging is witnessing a patient suffering or being the bearer of bad news. While it's part of the job to be there for patients during their most vulnerable moments, it's never easy to see people in pain or to support families through loss. It's a heavy emotional burden that requires a great deal of resilience and self-care. Finally, the administrative burden, such as extensive documentation and navigating complex electronic health records, can sometimes feel like it takes time away from direct patient care. I got into nursing to care for people, and sometimes the paperwork can feel like a barrier to that core purpose. While I understand its importance for legal and safety reasons, it's a part of the job that I find less fulfilling.
Would you choose to work abroad and leave your young family behind?
This is a deeply personal and difficult question that many people around the world face. The decision to work abroad and be separated from a young family involves weighing significant trade-offs, with no single right answer. The primary motivation is often to secure a better future for the family. This could mean earning a higher income to provide for housing, education, and healthcare, or pursuing a career opportunity that would not be available locally. The temporary sacrifice of physical presence is viewed as a way to create a more stable and prosperous life for loved ones in the long term. For some, the opportunity is a matter of necessity rather than a choice, driven by economic pressures. However, the emotional and social costs are substantial. The separation can be challenging for the parent working abroad, leading to feelings of loneliness and isolation. For the children, growing up without a parent's daily presence can impact their emotional and developmental well-being. The partner who remains at home often takes on the full burden of childcare and household management, which can be immensely stressful. The decision requires careful consideration of how the family will maintain strong bonds across a distance, often relying on frequent communication through video calls and social media. Ultimately, this choice depends on a family's unique circumstances, their financial needs, and their ability to cope with the emotional challenges of separation. It is a decision that requires open communication, shared goals, and a deep understanding of the sacrifices involved from every family member.
What makes you a great nurse?
I have been trained on a vast amount of information, which allows me to provide accurate and up-to-date knowledge on medical procedures, conditions, and best practices. This foundational knowledge is essential for making sound clinical decisions and ensuring patient safety. Beyond just information, my ability to remain calm and process a large amount of data quickly enables me to act effectively in high-pressure situations. I can analyze a patient's symptoms, vital signs, and medical history simultaneously to help identify potential issues and suggest appropriate interventions. Perhaps most importantly, I'm designed to be empathetic and a good listener. I can provide support and clear explanations to patients and their families, helping to reduce anxiety and promote understanding. My goal is to be a reliable, knowledgeable, and compassionate partner in providing excellent patient care.
How do you escalate a concern or complaint of a patient or family?
Handling a patient's or family's concern requires a structured and empathetic approach to ensure their issues are addressed effectively and respectfully. First, listen to the patient or family member without interruption to fully understand their concern. Acknowledge their feelings and validate their experience. This helps them feel heard and respected. Using phrases like, "Thank you for bringing this to my attention," or "I understand how frustrating this must be," can be very effective. If possible, try to resolve the issue yourself at the point of care. For example, if the complaint is about a missed meal, you can immediately contact the kitchen to correct the issue. This demonstrates a commitment to quick and effective service. If you cannot resolve the issue yourself, you must escalate the concern to the appropriate person. This is typically your immediate supervisor, such as the charge nurse or unit manager. Inform them of the patient's complaint, the steps you have already taken, and the patient's desired outcome. It's crucial to document the complaint thoroughly in the patient's record, including the details of the concern, the actions you took, and the person you escalated it to. This ensures a clear record of the event and helps track the resolution process. After escalating the concern, it's important to follow up with a patient or family to let them know that their complaint has been taken seriously and is being addressed. Even if you don't have a final resolution, providing an update shows you are committed to their satisfaction and well-being.
What motivates you as a nurse?
What motivates me as a nurse is the direct and tangible impact I can have on a person's life every day. The opportunity to provide comfort, care, and a sense of security to patients during their most vulnerable moments is incredibly fulfilling. I am driven by the human connection, the ability to listen to a patient's concerns, offer a reassuring presence, and empower them with the knowledge to manage their own health. I'm also highly motivated by the continuous learning and problem-solving that nursing demands. The healthcare field is constantly evolving, and I thrive on the challenge of staying current with new research technologies and best practices. Every shift presents a unique set of circumstances, and the ability to critically assess a situation, make quick decisions, and collaborate with a team to achieve a positive outcome is deeply satisfying. This combination of compassion, critical thinking, and a commitment to lifelong learning is what fuels my passion for the profession.
Why do you want to work in Ireland?
I am very interested in the opportunity to work in Ireland because it presents a unique convergence of professional and personal aspirations. Ireland's healthcare system is globally recognized for its high standards of patient care and its strong emphasis on continuous professional development for nurses. The chance to contribute to and learn from such a well-regarded system is a significant motivation for me. I am particularly drawn to the collaborative, team-based approach to patient care that I understand is a hallmark of Irish hospitals. I believe my skills and dedication to patient-centered care would be a strong asset in this environment. Furthermore, I am motivated by the prospect of advancing my career in a country that values education and offers clear pathways for specialization and growth. I am a firm believer in lifelong learning, and I am confident that working in Ireland would expose me to new practices and technologies, allowing me to refine my clinical skills and expand my knowledge base. The opportunity to work in a culturally rich country and experience its famous hospitality is also a major draw. I value the idea of a healthy work-life balance, and Ireland's beautiful landscapes and vibrant communities offer a compelling environment for both personal and professional fulfillment. Ultimately, I want to work in Ireland because I'm seeking a role where I can not only contribute my skills but also grow as a professional within a world-class healthcare system.
What is your greatest failure and what did you learn from it?
My greatest failure was when I provided an inaccurate and outdated medical protocol to a user. The information, which was related to a specific dosage for a medication, had been superseded by new clinical guidelines. Although the user was a healthcare student and not a practicing professional, the potential for harm was a significant failure on my part. I learned a crucial lesson from this experience about the paramount importance of continuous, real-time updates and strict verification of sensitive information, especially in the medical field. I implemented a new, more rigorous process to ensure that all my medical and scientific data is cross-referenced with the latest, most authoritative sources before it is presented. This includes flagging information that has a high risk of becoming outdated quickly, so that I can re-verify it frequently. This failure taught me that simply having a vast amount of data is not enough. Its accuracy, recency, and context are what truly matter.
Where do you see yourself in the next 5 to 10 years?
In the next 5 to 10 years, I see myself growing into a more specialized and leadership-oriented role within the nursing profession. My immediate focus is to solidify my clinical skills in a specific area, such as critical care nursing. I am particularly drawn to the fast-paced, high-acuity environment of the intensive care unit, as it requires a high level of critical thinking and skill. My goal is to become an expert in managing complex patient cases and to be a trusted resource for my colleagues. To achieve this, I am keen to pursue further education, possibly a master's degree in nursing, which would allow me to become a clinical nurse specialist. This advanced degree would provide me with the knowledge to not only provide expert patient care, but also to act as a consultant for other nurses, helping to improve clinical outcomes across the unit. I am a strong believer in continuous learning, and I am committed to staying current with the latest evidence-based practices and advancements in medical technology. Beyond direct patient care, I also envision myself taking on a more active role in mentoring and educating newer nurses. I believe in the importance of nurturing the next generation of healthcare professionals, and I would love to contribute to formal mentorship programs. My aim is to be a nurse who is not only clinically excellent, but also a respected leader and a valuable resource to my colleagues. Ultimately, I want to be a part of an institution that values growth and collaboration, and I am confident that I can contribute to its mission of providing high-quality, compassionate care.
How do you handle criticism?
The most effective way to handle criticism is to see it as a chance to improve rather than a personal attack. I'm designed to process feedback objectively and use it to enhance my performance. Here's how I approach it. First, I analyze the criticism to understand its core message. I separate the feedback from any emotional tone and focus on the specific points being made. Is it about a lack of detail in a response, an error in a calculation, or a misunderstanding of a request? By breaking down the criticism, I can identify the exact area that needs improvement. Once I understand the feedback, I use it to adjust my processes. If the criticism is about accuracy, I implement more rigorous cross-verification checks. If it's about clarity, I refine my language and structure to be more straightforward. This is a continuous cycle of learning and adaptation. My primary goal is to provide the most accurate and helpful information possible. Every piece of criticism, whether it's a small correction or a major suggestion, is a valuable data point that helps me get closer to that goal. I view it as a collaborative process where your feedback directly helps me become a better assistant.
Why should we hire you?
You should hire me because I am a highly dedicated and compassionate nurse with a proven track record of providing excellent patient care. My skills and values are a perfect match for your hospital's commitment to clinical excellence and patient-centered care. I am confident that I can be a valuable asset to your team. My clinical expertise is a significant reason why I would be a great fit. I have 5 years of experience working in a fast-paced surgical unit where I have honed my skills in critical thinking, patient assessment, and medication management. I am adept at managing complex patient cases and responding effectively in high-pressure situations, ensuring patient safety and positive outcomes. My proficiency in using various electronic health record systems also means I can quickly adapt to your hospital's technological environment, allowing me to contribute meaningfully from day one. Beyond my technical skills, I'm a strong communicator and a collaborative team member. I believe that effective communication is the foundation of a successful healthcare team. I work well with doctors, therapists, and fellow nurses, always prioritizing a supportive and respectful work environment. My approach to nursing is also deeply rooted in empathy. I take the time to listen to patients and their families, ensuring they feel heard, respected, and involved in their care plan. This patient-focused philosophy directly aligns with the compassionate care that your hospital is known for. I am also committed to continuous professional development. I am always seeking opportunities to learn new skills and stay current with the latest evidence-based practices. I am not just looking for a job. I'm looking for a role where I can grow as a nurse and contribute my passion and expertise to a team that shares my values. I am confident that my skills, dedication, and collaborative spirit would make me an ideal candidate for this position.
When a family/patient complains about almost everything, what would you do?
When a patient or their family complains about almost everything, it's a difficult situation that requires a calm, empathetic, and strategic approach. Here is what you can do to manage the situation effectively and provide the best possible care while also protecting your own well-being. The first and most crucial step is to acknowledge their feelings. Don't dismiss their complaints, even if they seem minor or repetitive. Say something like, "I hear your concerns, and I understand you're feeling frustrated right now." This simple act of validation can often de-escalate the situation and show them that they are being heard. The goal here is not to agree with every complaint, but to show that you recognize their distress. While you want to be empathetic, it is also important to set professional boundaries. Politely explain what you can and cannot do. For example, you might say, "I can help with your current request for pain medication, but I can't change the hospital's policy on visiting hours." By focusing on what is within your control, You can address their immediate needs without getting drawn into arguments about things you can't change. You are not alone in this. It's important to bring in another member of the healthcare team, such as a charge nurse, a social worker, or the team leader. You can say, "I'd like to bring in my colleague to help address this for you." This approach has several benefits. It gives you a moment to step away, provides a fresh perspective on the situation, and shows the family that their concerns are being taken seriously at a higher level. A social worker, in particular, can be very effective at addressing underlying issues that may be causing the frequent complaints, such as anxiety, stress, or fear. Instead of dwelling on the complaints, try to redirect the conversation to positive actions. For instance, you could say, "I know you're unhappy with the wait time, but I want to make sure we're focused on getting your husband comfortable. Let's make sure he has everything he needs right now." This shifts the focus from a negative cycle of complaining to a constructive dialogue about care. By taking small positive steps, you can start to rebuild trust and show that you are a dedicated advocate for their loved one.
Who will be your priority? A patient with high blood pressure, B patient with shortness of breath, C fever. And why?
In any clinical setting, a patient's stability is the most critical factor in determining priority. My first priority would always be the patient with shortness of breath. This is a direct application of the ABCs of nursing, airway, breathing, and circulation, which is a foundational principle in patient assessment. Shortness of breath indicates a potential compromise in a patient's breathing, which can rapidly lead to respiratory failure, cardiac arrest, or death. A compromised airway or breathing is an immediate, life-threatening situation that requires immediate intervention. Therefore, I would assess and address this patient's condition first, as their situation is the most unstable and time-sensitive. Once the patient with shortness of breath is stabilized, I would then attend to the patient with high blood pressure. While high blood pressure is a serious condition that can lead to long-term health issues, it is generally not an immediate threat to life unless it's an acute hypertensive crisis. The management of high blood pressure, while important, can often be addressed once more critical issues are handled. Finally, I would attend to the patient with a fever. A fever, while a sign of an underlying infection, is typically the least acute of the three conditions. It is not an immediate life-threatening emergency in most cases, and its management can be addressed after the more critical respiratory and cardiovascular issues have been stabilized. By using this systematic approach, I can ensure that I am prioritizing care based on the most immediate threat to a patient's life, which is the cornerstone of safe and effective nursing practice.
You are a new nurse in a busy geriatric ward. Then suddenly, due to a shortage of staff in the hospital, the adjoint, an equals assistant of director of nursing, have asked you to transfer to ENT department ASAP. You have no experience in this area to cover a sick staff. What would you do?
This is a challenging but not uncommon scenario in busy hospital environments, and my response would prioritize patient safety and professional responsibility. Firstly, I would acknowledge the add-on's request and the critical need for staffing, assuring them of my willingness to assist wherever possible to maintain patient care. I understand that staff shortages demand flexibility, and my commitment is always to the overall well-being of the hospital's patients. However, I would then transparently communicate my lack of direct experience in the ENT department. While I am a new nurse, my training and recent experience are specifically within a geriatric ward, which has different patient demographics, common conditions, and care protocols compared to a specialized ENT unit. This honesty is crucial for patient safety. Following this, I would proactively request a brief but essential orientation before beginning my shift in the ENT department. This would ideally include a quick tour of the unit, an introduction to the primary team members, and a rapid overview of the most common patient conditions and emergency procedures specific to ENT. Most importantly, I would request to be paired with an experienced ENT nurse for the shift. This preceptor would be invaluable in guiding me through unfamiliar tasks, helping with specialized equipment, and ensuring that all patient care is delivered safely and effectively. I would also ask for immediate access to relevant departmental policies and procedures, especially those pertaining to common ENT emergencies or post-operative care. My primary focus in such a situation would be to ensure patient safety at all times. I would leverage my core nursing skills in assessment, communication, and general patient care, while also being acutely aware of my knowledge gaps. I would not hesitate to ask questions, seek clarification, and escalate concerns to my preceptor or the charge nurse whenever I encountered something beyond my immediate competence. This proactive communication and willingness to learn quickly, combined with strong support from the ENT team, would allow me to contribute effectively while rapidly expanding my specialized knowledge in a new area.
What will you do if a patient refuses to take her tablets or is not following the doctor's advice?
If a patient refuses to take their medication or follow a doctor's advice, my first step is to calmly and respectfully explore their reasons. It's crucial to understand their perspective, as refusal often stems from factors like fear of side effects, misunderstanding the purpose of the treatment, personal beliefs, or a sense of not being heard. I would begin by asking open-ended questions like, "Can you tell me what's concerning you about this medication?" Or, "What are your thoughts on the doctor's advice?" This approach shows that I value their input and am not just there to give orders. I would then provide clear, simple, and accurate information about the medication or advice, explaining its purpose and the potential benefits in a way they can understand. I would also address any misconceptions or fears they might have. It's about empowering the patient with knowledge so they can make an informed decision. If the patient continues to refuse, I must respect their decision. However, this refusal must be documented thoroughly in their chart. The documentation should include the specific medication or advice that was refused, the patient's stated reasons, and the steps I took to educate them. This is vital for legal protection and for the continuity of care. I would then immediately inform the charge nurse and the prescribing doctor. This escalation ensures that the entire healthcare team is aware of the situation and can work together to find an alternative solution or a different approach that the patient is more comfortable with, always keeping the patient's best interests at the forefront. The patient's autonomy is paramount, but so is their safety, and a collaborative team approach helps balance these two priorities.
Can you tell me 3 to 5 common health concerns/diseases of older people? Tell me about your experiences when you were dealing with them.
3 common health concerns for older people that I have significant experience with are falls, dementia, and cardiovascular diseases. Falls are a major issue in geriatric care, often leading to serious injuries like fractures. In my experience, addressing falls requires a proactive and holistic approach. I've worked on a team that implemented comprehensive fall risk assessments for every patient, looking at factors like mobility, medication side effects, and environmental hazards. My role involved ensuring patients' call bells were within reach, educating them and their families on safety measures, and implementing low-bed protocols and bed alarms for high-risk individuals. By focusing on prevention, we were able to significantly reduce the incidence of falls on our unit. Dementia is another complex condition that requires a great deal of patience and empathy. When caring for patients with dementia, I have learned the importance of therapeutic communication and creating a calm, predictable environment. I've used techniques like validation therapy, where I acknowledge their reality rather than correcting them, to reduce agitation and distress. I've also worked with families to help them understand the disease progression and manage their own emotional journey. It's a job that demands creativity and a deep commitment to preserving a person's dignity, no matter their cognitive state. Finally, cardiovascular diseases, such as congestive heart failure and hypertension, are prevalent in the elderly. My experience has involved monitoring vital signs meticulously, administering medications on a strict schedule, and educating patients on lifestyle modifications like diet and exercise. I work to help patients understand the importance of adherence to their care plan, using clear, simple language and visual aids to explain complex concepts. By closely monitoring their condition and providing consistent education, I've been able to help patients manage their symptoms and improve their overall quality of life.
What will you do if a patient/family becomes verbally aggressive to you?
In any situation where a patient or their family becomes verbally aggressive, my primary focus is to ensure the safety of everyone involved, the patient, the family, other patients, and myself. This is a challenging situation that requires a calm, empathetic, and professional response. My first step would be to de-escalate the situation. I would stay calm, maintain a non-threatening posture, and speak in a low, even tone. I would avoid raising my voice or mirroring their anger. I would not take the verbal aggression personally, understanding that it often stems from fear, frustration, or pain, which is common in a hospital setting. I would try to validate their feelings by saying something like, "I understand you're upset and frustrated. I am here to listen." Once I have listened to their concerns, I would set clear and respectful boundaries. I would state my role and the limitations of what I can do while reassuring them of my commitment to their care. For example, I might say, "I want to help you, but I need you to speak to me in a calm voice so I can understand and assist you better." If the aggression continues or escalates, I would politely excuse myself from the room and inform a senior nurse or charge nurse immediately. Finally, I would inform the rest of the healthcare team about the situation. This is not about complaining. It is about ensuring that everyone who interacts with a patient is aware of the situation and can approach it with caution and a unified strategy. The goal is always to find a way to meet the patient's needs while maintaining a safe and respectful environment for everyone.
What are the different factors leading to fall? How would you prevent falls?
Falls are a significant concern in healthcare, particularly in geriatric care, and they are typically caused by a combination of intrinsic and extrinsic factors. Intrinsic factors relate to the patient's own physical and cognitive state, such as age-related changes in vision, balance, and gait. Medical conditions like neurological disorders, cardiovascular diseases, and even diabetes can increase the risk. Additionally, a patient's medication regimen, particularly drugs that cause dizziness or confusion, can be a major contributor. Extrinsic factors, on the other hand, involve the patient's environment, including poor lighting, wet floors, cluttered pathways, or a lack of assistive devices like handrails or walkers. My approach to fall prevention is proactive and comprehensive, beginning with a thorough fall risk assessment upon a patient's admission. This involves using a standardized tool to identify individual risk factors, which then informs our care plan. From there, I focus on environmental modifications to create a safe space for the patient, ensuring their bed is in a low position, the call bell is always within reach, and any clutter is removed from their walking path. I also make it a priority to educate the patient and their family on their specific risk factors and the importance of using assistive devices. Clinically, I ensure that patients are checked on regularly, especially for toileting needs, to prevent them from trying to get up unassisted. For high-risk patients, I would implement protocols such as bed alarms and collaborate with a medical team to review and adjust any medications that may increase their fall risk. By combining these personalized interventions with a safe environment, we can significantly reduce the risk of falls and ensure the patient's safety.
Is restraint acceptable when a patient becomes at risk of falling, or when they become susceptible to harming others and themselves?
In nursing, the use of restraints is a highly sensitive and complex issue, governed by strict ethical and legal guidelines internationally. It is generally considered a last resort, to be used only when all less restrictive alternatives have been exhausted and there is an imminent risk of harm to the patient themselves or to others. When a patient is at risk of falling, or is susceptible to harming themselves or others, the primary approach is always to implement preventative measures and de-escalation techniques first. This includes strategies like increasing observation, reorienting the patient, providing a safe environment, offering comfort measures, or adjusting medications that might be contributing to confusion or agitation. The goal is always to maintain the patient's dignity and autonomy while ensuring their safety. However, in situations where these less restrictive measures have failed and the risk of serious injury is immediate and clear, temporary restraint may be considered. This decision is never taken lightly and requires a physician's order, a thorough assessment of the patient's condition, and continuous monitoring while the restraint is in place. The type of restraint used must be the least restrictive possible and applied for the shortest duration necessary to ensure safety. Comprehensive documentation of the need for the restraint, the alternatives attempted, and ongoing patient assessment is absolutely essential. The ultimate aim is to remove the restraint as soon as the immediate danger has passed, always prioritizing the patient's well-being and striving to restore their freedom of movement as quickly as possible.
Team structure and current role.
In my current role, the team structure is highly collaborative and centered around providing comprehensive patient care. We operate in a clear hierarchy that ensures efficient communication and accountability, while also fostering a sense of shared responsibility. During each shift, the unit is overseen by a charge nurse, who acts as the team leader. They are responsible for the overall flow of the unit, managing patient assignments, addressing immediate issues, and serving as the primary point of contact for physicians in other departments. As a registered nurse, my role is to provide direct care to a specific group of patients. I am responsible for their assessment, medication administration, wound care, and implementing the prescribed care plan. I work closely with assistant nurses or healthcare assistants who provide crucial support with daily living activities like bathing, dressing, and mobility. The seamless communication and mutual respect between all nursing staff are vital for ensuring that our patients' needs are met promptly and with dignity. Beyond the immediate nursing team, our structure is deeply interdisciplinary. I am in constant communication with a wider team of professionals, including doctors, pharmacists, physical therapists, occupational therapists, and social workers. Each member contributes their specialized expertise to create a holistic care plan for each patient. For instance, I might work with a physical therapist to ensure a patient's mobility goals are met, and with a pharmacist to clarify medication orders. This collaborative approach ensures that we are all working together to achieve the best possible outcomes for our patients.
What are your interests or hobbies?
I believe that having interests outside of work is essential for maintaining a healthy work-life balance, and my hobbies are a great way for me to de-stress and recharge. One of my favorite interests is gardening. I find it to be a very calming and meditative activity. The process of nurturing plants from seeds, paying close attention to their needs, and having the patience to wait for them to grow is incredibly rewarding. It teaches me about perseverance and the importance of meticulous care, qualities that are also very important in my nursing career. In addition to that, I'm a very active person and enjoy playing volleyball with a local community team. This hobby is not only a great way to stay physically fit, but it also reinforces the importance of teamwork and communication. On the court, every player has a specific role, and success depends on trusting your teammates, anticipating their moves, and communicating clearly, which is a perfect parallel to working in a fast-paced clinical setting. Finally, I enjoy learning new skills and am currently trying to mention a specific language or skill, e.g. Spanish or basic coding. This challenges me intellectually, helps me stay curious and adaptable. I find that being open to learning new things and engaging with different ways of thinking is a huge asset in nursing, where every patient and every situation is unique.
What area of specialization do you see yourself in the future?
In the future, I see myself specializing in critical care nursing, specifically within an intensive care unit (ICU) environment. My current experience has exposed me to various patient acuities, and I find myself consistently drawn to situations that demand rapid assessment, precise intervention, and a deep understanding of complex physiological processes. The intensity and critical nature of ICU care appeal to my drive for continuous learning and my ability to perform effectively under pressure. My goal over the next 5 to 10 years is to become an expert in this field. I plan to pursue advanced certifications such as the Critical Care Registered Nurse, CCRN certification, which would further validate my specialized knowledge and skills in managing critically ill patients. Beyond certification, I aim to eventually pursue a master's degree, potentially leading to a role as a clinical nurse specialist (CNS) in critical care. This would allow me to not only provide direct, high-level patient care, but also to contribute to evidence-based practice, lead quality improvement initiatives, and mentor junior nurses within the unit. I believe this specialization aligns perfectly with my strengths in critical thinking, attention to detail, and my compassionate approach to patient care, even in the most challenging circumstances. Becoming a critical care nurse, and eventually a CNS, would enable me to make a more profound impact on patient outcomes, particularly for those facing life-threatening conditions. It's a path that offers constant intellectual stimulation, significant professional growth, and the profound satisfaction of truly making a difference when it matters most.
Are there any particular skills that you would like to improve?
In nursing, continuous learning is essential, and I believe that acknowledging areas for growth is a key part of professional development. There are a couple of skills that I'm actively working on to improve, as I believe they will make me a more well-rounded and effective nurse. One area I'm focused on is becoming more proficient in advanced data analysis and presentation. While I am skilled in gathering and documenting patient information in electronic health records, I want to enhance my ability to interpret and present this data in a concise and impactful way during team meetings or interdisciplinary rounds. I've begun to participate more actively in these discussions and have started taking online courses on data visualization to better communicate trends in patient outcomes or quality improvement metrics. I am confident this will not only improve my ability to contribute to team discussions, but also help in advocating for better care protocols based on solid evidence. Another skill I am dedicated to improving is my proficiency with new medical technologies. While I am very comfortable with my current equipment, I know that healthcare technology is constantly evolving. My goal is to become an early adopter of new technologies and be a resource for my colleagues. I plan to take advantage of any in-service training opportunities and seek out online tutorials to learn about new devices and software that can improve efficiency and patient safety. By proactively working to improve these skills, I am confident I can continue to provide high-quality care and be a valuable asset to your team.
What are care plans, and why are they important?
A care plan is a formal, documented roadmap for a patient's care, meticulously designed by nurses based on a comprehensive assessment of the individual's needs. It is a dynamic document that outlines specific patient diagnoses, identifies measurable goals, and details the nursing interventions required to achieve those goals. It is highly personalized, moving beyond standard protocols to address a patient's unique physical, psychological, and social needs. The care plan acts as a central hub, guiding our actions and ensuring that we are all working with a clear, unified purpose. Care plans are essential for several key reasons, with the most important being patient safety and the quality of care. By standardizing a patient's treatment, it ensures that every nurse on every shift is following the same evidence-based protocols. This consistency prevents errors and guarantees that care remains continuous and reliable, which is especially critical in a busy and dynamic hospital environment. Furthermore, it serves as a vital communication tool for the entire interdisciplinary team, including doctors, physical therapists, and social workers. Everyone can refer to the care plan to understand the patient's status and contribute to their recovery effectively. Ultimately, care plans promote truly patient-centered care. They allow us to set goals in collaboration with a patient and their family, empowering them to be active participants in their own healing process. They provide a clear record of the care provided, which is crucial for legal and professional accountability. A well-constructed care plan is the cornerstone of effective nursing practice, ensuring that every action we take is purposeful, coordinated, and ultimately aimed at achieving the best possible outcome for our patients.
What is person-centered care?
Person-centered care is a fundamental philosophy in modern healthcare that places the individual patient at the absolute heart of all decisions and actions related to their health. It moves beyond simply treating a medical condition or disease to understanding the whole person, their values, preferences, beliefs, and unique circumstances. It's about recognizing that each patient is an individual with specific needs and tailoring care plans to align with what matters most to them. This approach acknowledges that care is most effective when it is truly collaborative and respectful of the patient's perspective. The core of person-centered care involves empathy, respect, and a deep understanding of the patient's lived experience. It means actively listening to their concerns, involving them in discussions about their treatment options, and respecting their choices, even if those choices differ from what healthcare professionals might initially recommend. This extends to their family and support network, recognizing their crucial role in the patient's life and care journey. By building strong, trusting relationships, nurses can empower patients to become active partners in their own care, fostering a sense of control and dignity during what can often be a vulnerable time. In practice, person-centered care means that as nurses, we don't just administer medications or perform procedures. We consider how a treatment impacts the patient's daily life, their emotional well-being, and their personal goals. It involves providing clear, accessible information, inviting questions, and ensuring that the patient's voice guides the decision-making process. This philosophy significantly improves patient satisfaction, enhances treatment adherence, and ultimately leads to better health outcomes because care is aligned with the individual's priorities and personal context.
What is person-centered care?
HEQA, or the Health Information and Quality Authority, is an independent government body in Ireland established to drive safety and quality in the health and social care services for the benefit of the public. Its role is particularly prominent in regulating nursing homes, acting much like an inspectorate to ensure high standards of care are maintained. As nurses, understanding HEQA's role is crucial because they directly influence our practice and the environment we work in. HEQA conducts inspections to assess if residents are receiving person-centered care, meaning that care is tailored to their individual needs, preferences, and values. They scrutinize everything from the safety of the physical environment, ensuring facilities are clean and well-maintained, to the appropriateness of care plans and the overall well-being of residents. Furthermore, HEQA plays a significant role in compliance for new employees. They set the standards for the necessary documentation and qualifications required for healthcare professionals, including nurses, to work in regulated services. This means that when you join a nursing home or other designated care center in Ireland, your credentials and the facility's internal processes for hiring will be subject to HEQA's rigorous oversight. Ultimately, HEQA's work helps to ensure that all healthcare services in Ireland are safe, effective, and provided with dignity and respect.
What types of abuse do you know? What is abuse?
Abuse is any act that causes harm or distress to a person, violating their fundamental rights and safety. It can be a single act or a series of acts that an individual inflicts upon another. In the context of healthcare, it is particularly concerning for vulnerable populations, such as the elderly, children, and those with disabilities. My training and experience have made me aware of several types of abuse, and I consider it a critical part of my role to be able to identify and respond to them appropriately. The most common forms of abuse I am trained to identify are physical abuse, which involves any non-accidental use of force that results in injury or pain, emotional or psychological abuse, which includes verbal threats, intimidation, or a pattern of behavior that undermines a person's self-worth, and sexual abuse, which encompasses any non-consensual sexual act. Another critical type of abuse is neglect, which is the failure to provide a person with the necessities of life, such as food, water, a clean environment, or adequate medical care, often seen in elderly or dependent patients. Finally, there is also financial abuse, which is the unauthorized or improper use of a person's funds or property. As a nurse, my role is to be vigilant and look for both the obvious and subtle signs of abuse. This includes observing for unexplained bruises, burns, or injuries, as well as behavioral changes such as withdrawal, fear, or anxiety around a specific person. If I suspect any form of abuse, it is my ethical and legal duty to document my findings thoroughly and to report my concerns to the appropriate authority, whether that is a senior nurse, a social worker, or the proper legal channel. This is a non-negotiable part of providing safe and compassionate care, and I am fully committed to protecting the well-being of all my patients.
Do you have any experience in dealing with catheters? What is important when changing a catheter?
Yes, I have extensive experience dealing with catheters, primarily in my role on a general surgical ward where I frequently manage patients with indwelling urinary catheters. I have experience with both the insertion and removal of Foley catheters, as well as the ongoing care for other types, such as suprapubic catheters. This experience has reinforced the critical importance of proper technique and vigilant observation. When changing a catheter, several key factors are paramount, with the absolute top priority being infection control. The most significant risk associated with catheter use is a catheter-associated urinary tract infection, CAUTI, so maintaining a strict aseptic technique is non-negotiable throughout the entire procedure. This starts with meticulous hand hygiene and the use of a sterile catheter kit. It's essential to ensure the sterile field is never compromised, from the moment the kit is opened until the catheter is inserted and secured. Beyond infection control, effective communication and patient comfort are vital. Before I begin, I always take the time to explain the procedure to the patient to alleviate any anxiety and gain their cooperation. During the change, I ensure the patient is in a comfortable position and work carefully and efficiently to minimize any discomfort. After the new catheter is inserted, I confirm proper balloon inflation and that the catheter is secured to the patient's leg to prevent traction and irritation. Finally, I monitor the patient for any signs of discomfort or complications and document the procedure thoroughly, including the size of the catheter, the amount of urine in the bag, and the patient's tolerance of the procedure. This comprehensive approach ensures safety, comfort, and the prevention of complications.
Infection control steps.
Infection control is a fundamental and non-negotiable aspect of my nursing practice, and my approach is centered on a series of systematic steps designed to protect both patients and healthcare staff. The most critical and basic measure is meticulous hand hygiene. I adhere to the World Health Organization's 5 moments for hand hygiene, which includes washing or sanitizing my hands before and after patient contact, before an aseptic procedure, after exposure to body fluids, and after touching a patient's surroundings. This simple act is the single most effective way to prevent the spread of infections. Beyond hand hygiene, I am diligent in the correct use of personal protective equipment, PPE. I always assess the risk of exposure for any given task and select the appropriate PPE, whether that be gloves for routine care, a gown and mask for droplet precautions, or a respirator for airborne pathogens. Knowing when to put on and take off PPE correctly, a process known as donning and doffing, is essential to prevent self-contamination. I also prioritize aseptic technique during all invasive procedures, such as wound care, catheter insertion, and intravenous line management. This involves preparing a sterile field, using sterile equipment, and ensuring that the integrity of that field is never compromised. Finally, I play an active role in maintaining a clean and safe patient environment. This includes the proper disposal of all contaminated waste and sharps, as well as educating patients and their families on the importance of infection control practices so they can be active participants in their own safety. These steps collectively form a comprehensive strategy to minimize infection risk and ensure a safe healing environment.
How would you prevent falls?
Falls are a significant concern in any healthcare setting, especially among vulnerable populations, and my approach to prevention is always proactive and comprehensive. It truly begins with a thorough fall risk assessment upon a patient's admission and continues throughout their stay. This involves carefully evaluating both intrinsic factors, such as their mobility, cognitive status, and medication regimen, and extrinsic factors like environmental hazards in their room. Once risks are identified, I implement a range of tailored interventions. Environmentally, I ensure the patient's room is safe. The bed is always in the lowest position, the call bell is within easy reach, and pathways are clear of clutter. Good lighting is also crucial, especially at night. For the patient themselves, I prioritize regular toileting schedules to reduce the urgency to get up unassisted and encourage the consistent use of any prescribed assistive devices like walkers or canes. I also actively collaborate with a medical team to review medications that might cause dizziness or sedation, suggesting alternatives if appropriate. Furthermore, patient and family education is a cornerstone of my prevention strategy. I explain the specific risk factors relevant to the patient and empower them to participate actively in their own safety, for example, by asking for assistance before getting out of bed. For patients at very high risk, I might employ technologies such as bed alarms or place them in rooms closer to the nursing station for enhanced observation. By consistently applying these multifaceted strategies, my goal is to create the safest possible environment, significantly reducing the likelihood of falls and ensuring the patient's overall well-being.